All right, today we're going to crack the code on one of the most common yet most powerful tests in all of medicine, the urinalysis. Seriously, it's way more than just a simple test. It's like a full-on biological investigation. Every single day, in clinics and hospitals all over the world, this one test provides a flood of critical clues. We're talking about everything from a simple infection to your hydration levels, all the way to serious kidney disease. It really is a fundamental piece of the diagnostic puzzle.
But have you ever stopped to wonder? You hand over this little cup, and a little while later, your doctor suddenly has all this information. So what secrets are they actually unlocking from that sample?
To really get it, let's follow that sample on its journey. We're going to break it all down into the 3 key stages of analysis that turn a simple liquid into a super detailed report card on your health.
Okay, so before any lab tech even looks at anything, we have to talk about the most critical step of all, getting a good sample. Because think about it, if the sample you start with is flawed, the results are going to be flawed too. The accuracy of the whole entire test depends on getting this first part right.
So the technique here is absolutely crucial. You've got to use a sterile container. That's a no-brainer. The midstream clean catch method, that's all about minimizing contamination from bacteria on the skin. And timing is everything. That sample needs to be looked at within 2 hours or popped in the fridge. Otherwise, bacteria can start to multiply like crazy and the important cells can break down, which can totally skew the result.
Once the lab has a quality sample, the investigation officially begins. And stage 1 is the simplest, but it can give some immediate and really important clues. It's all about what the technician can see with their own eyes, basically the color and the clarity.
And what's so cool here is just how much the color alone can tell a doctor. Red or pink? That often points to bleeding somewhere in the urinary tract, maybe from an infection or a kidney stone. But a darker, kind of cola brown color? That's a huge clue that the bleeding might be coming from deep inside the kidney itself, from those tiny filters called the glomeruli. That's what's known as glomerular bleeding.
The next visual clue is something called turbidity, which is really just a fancy word for cloudiness. Now, if the sample isn't clear, it could be something totally harmless, like a few extra phosphate crystals. But, and this is a big but, it could also be caused by a ton of white blood cells, a condition called puria, which is a classic telltale sign of an infection.
So let's move on to stage 2. After the simple visual check, it is time for a chemical deep dive, and this is done with a urine dipstick, this little plastic strip that's basically a miniature laboratory, giving a super fast snapshot of the urine's chemical makeup.
The process itself has to be pretty precise. You dip the strip, wipe off the extra, and then you have to hold it horizontally so the different chemical pads don't bleed into each other. Then, after a specific amount of time, the colors that show up on those little pads are compared to a chart, and boom, you know what key substances are present or absent.
One of the most important things that dipstick is looking for is protein. See, healthy kidneys are like these amazing, superfine filters, and their job is to not let big molecules like protein get through. So when a significant amount of protein shows up, that's a condition called proteinuria. It's a major red flag that the kidney's filtration system might be damaged. The dipstick is also an excellent detective for sniffing out infections. It tests for 2 things. First, leukocyte esterase, which is an enzyme that comes from the white blood cells that are fighting an infection. And second, nitrites, which are produced by the most common bacteria that cause UTIs. If you get a positive on both of these, that is a very, very strong sign that you're dealing with a urinary tract infection.
Okay, so the visual and chemical tests give us some powerful clues, but stage 3 is where those clues get confirmed. This is the microscopic analysis, where a trained eye literally looks at the sediment to see exactly what kind of cells, crystals, or other little things are hanging out in there. And this is one of the most incredible things the microscope can do. Remember how we talked about the different colors of bleeding? Well, under a microscope, doctors can actually figure out the source of the bleeding just by looking at the shape of the red blood cells. If they're all smooth and round, the bleeding is probably from the lower urinary tract. But if they're all warped and misshapen, or dysmorphic, it means they've been squeezed through the kidney's tiny filters, a clear sign of kidney disease.
And here, you can see it for yourself. On the right, those are normal, uniformly round red blood cells. You'd see if the bleeding wasn't coming from the kidney. But now, look at the cells on the left. See how they're all irregularly shaped, with these little bulges and distortions? That is the classic telltale sign of dysmorphic cells that have been forced through a damaged glomerulus. Now, if there is one thing that absolutely screams the bleeding is coming from the kidney, this is it. These are called red blood cell casts.
They are literal molds of the kidney's tiny tubes, formed when red blood cells get all packed together inside them. Finding even one of these is pretty much definitive proof that the bleeding is coming from inside the kidney itself. It's the smoking gun.
The microscope also reveals crystals, and for patients with kidney stones, their geometry is a crucial clue. The shape tells the whole story. Hexagonal crystals, like you see there, point to a specific genetic condition. And those classic envelope-shaped crystals, those are calcium oxalate, which is by far the most common type of kidney stone.
And finally, the microscope gives us the ultimate confirmation of a UTI. The dipstick gave us those strong chemical hints, right? Well, seeing the actual bacteria under the microscope, often swimming around with white blood cells like you see here, leaves absolutely no doubt about the diagnosis.
So we've walked through all 3 stages of the investigation. The final and most important step for the doctor is to put all this information together, from the visual, the chemical, and the microscopic, to build one complete picture of what's going on.
Each part just builds on the last one. The gross examination, the look and see, gives the first hints. Then the dipstick provides that rapid biochemical screen for all the key markers. And finally, the microscopic analysis delivers the definitive confirmation, letting doctors not just identify a problem, but often pinpoint its exact location. And this really is the key takeaway. A truly complete urinalysis isn't just one of these things, it's all 3 of them working together. As the source material says so clearly, these 3 stages form the gold standard for a thorough evaluation.
It's pretty amazing when you think about it, isn't it? From one simple, totally painless sample, you get this detailed, complex story about your internal health. Everything from infections to serious kidney disease. It really makes you think. What story is just waiting to be told in your next routine test?